Welcome, ladies and gentlemen. Bonsoir, mesdames et messieurs. You can all hear me. I have a very low voice, and I've been practicing. Un grand plaisir ce soir. Mon nom est Jeff Chamy, président, directeur général de la Fondation du cancer des cèdres au Centre Université Santé McGill at the MUHC. I have the privilege of being the president of the Cedars Cancer Foundation. Je suis très content de vous voir en si grand nombre ce soir. Virtually, à peu près 100 personnes, and in the house, here at the hospital, à peu près une cinquantaine de gens, des participants. Nous avons environ, comme j'ai dit, 100 participants par Zoom et environ 50 participants dans la salle. Ce soir, nous soulignons la Journée mondiale contre le cancer et nous allons aborder son thème, Unis par l'unique. Parce que chaque diagnostic de cancer est une histoire humaine unique et chaque patient mérite des soins personnalisés et centrés sur lui. Au Centre de cancer des cèdres, nous faisons de notre mieux pour placer les personnes au centre des soins et leurs histoires au cœur de la conversation. Good evening, ladies and gentlemen. As I mentioned, my name is Jeff Chamy. I'm the president and CEO of Cedars. I'm happy you've joined us virtually and en présence in person tonight. Supporting education is an important part of our mission at the Cedars Cancer Foundation. Through these Cedars Cancer Board public lectures, we aim to provide you, our community members, with the latest information about cancer treatments and cancer care. Tonight's public lecture marks World Cancer Day. World Cancer Day is an international day marked every year, le 4 février, the 4th of February, to raise awareness of cancer and to encourage its prevention, its detection, and its treatment. World Cancer Day is led by the Union for International Cancer Control in Switzerland, of which Cedars is a proud member. This year, the theme of World Cancer Day is United by Unique, because every cancer diagnosis is a unique human story, and every patient deserves personalized, patient-centered care. At the Cedars Cancer Center at the MUHC, we strive to put people at the center of care and their stories at the heart of the conversation. Tonight, our speakers, who I'll introduce in a moment, will talk about the uniqueness of every patient and of every patient experience and about the importance of caring for the individual, not only their illness. I'm grateful to our speakers here tonight, ladies and gentlemen. I'm grateful to the Cedars Cancer Board team that have organized this special evening. And following the presentation, we'll have a question and answer period that I'll moderate, to which you can ask questions en anglais, en français, as well as questions online. We're going to try to make this efficient, exciting, inspirational to give you information. Without further ado, before I introduce our conférenciers, for those participating by Zoom, please keep your microphone on mute at all times, unless it's to ask a question during the Q&A. Avant de céder la parole à nos conférenciers, je veux demander aux personnes qui participent par Zoom de garder leur micro fermé en tout temps. Ladies and gentlemen, and before I start introducing our wonderful speakers who have given their time tonight to educate and inform and inspire us, I just want to do a shout out. In the house tonight, we have the Honorable Tony Lafredas from the Senate, our senator here in Westmount, Tony, and his wife, Angie. And Angie is a cousin of Teresa, our inspirational testimonial tonight. So, and their family, welcome. We also have in the house some doctors, some allied health, some practitioners, social workers, nurses, caregivers. For all of you, another shout out. We thank you so much to our few Cedars board members. I see Anthony Calvillo, a longtime Cedars Cancer board member. And to Gwen Nakos, our founder, who I think is parking and is on our way in. To Gwen, who founded Cedars 35 years ago, thank you. Without further ado, ladies and gentlemen, it gives me great privilege. Before, I was just told I have to thank our community organization. And those are the women and men outside who have brought kiosks of information to VOBOC, to Cancer de la Vessie Canada, Bladder Cancer Canada, to Cancer Colorectal Canada, Colorectal Cancer Canada, to Melanome Canada, Melanoma Canada, Groupe de soutien du cancer de la prostate, the Montreal Prostate Cancer Support Group of the Montreal and West Island, and to Kidney Cancer Canada. Thank you for coming, for sharing your information with our patients and their families. And now I would like, without further ado, I would like to introduce our first speaker, who will come on virtually. Dr. Justin Sanders is the director of the MUHC's Division of Supportive and Palliative Care and Director of Palliative Care McGill. Justin is currently traveling at an international conference, but we've asked him to, through Hollywood Squares, to come in and give us a short message. Dr. Justin Sanders.
My name is Justin Sanders, and I have the privilege of directing the Division of Supportive and Palliative Care at the Cedars Cancer Center and partnering closely with the Cedars Cancer Foundation to design and ensure the highest quality care for patients with cancer. I regret that I cannot be with you to celebrate World Cancer Day. The theme this year, United by Unique, is one that I find particularly resonant. If it is a goal of medical care to diagnose and treat, to paraphrase Dr. William Osler, the disease that the person has, it is our longstanding goal in palliative care to do what Dr. Osler thought was more important, to understand the person who has the disease. It is only through our recognition of one's essential humanity and the unique goals, values, and preferences of people and their caregivers that we are able to provide the very best cancer care, no matter the outcome of treatment. Cancer profoundly disrupts the world of those who experience a diagnosis. The physician Eric Cassell wrote that suffering is a matter of meaning, and meaning is derived from our experience as social, emotional, and spiritual beings. We cannot address this suffering with chemotherapy, immunotherapy, surgery, or radiotherapy. This is why some say that we can treat or cure cancer while wounding the soul. Our collective goal is to help avoid this outcome by understanding the social, emotional, and spiritual lives of our patients so that we can nurture them in the best way possible. Every person that cancer touches brings with them a collection of unique experiences, goals, perspectives, and strengths, and it is only by understanding this uniqueness that we can best help people make it through this experience as whole people. We're building a new care delivery model, the Cedars Program in Whole Person Cancer Care, to ensure that we are oriented toward and have the capacity to ensure that all people who come through our doors feel that we care for them as unique individuals. In a system that is increasingly fragmented and in a healthcare encounters that feel increasingly transactional, this could not be a more timely endeavor. If you're interested to work with us in making this care delivery model a reality, I hope you'll reach out to me. I hope everyone in the audience and online can take a moment on this World Cancer Day to reflect on and honor the unique journey for everyone affected by cancer. Know that we in our division are here to ensure that at every step of the journey, we are doing the same. Take care. Have a great evening.
I now invite Dr. Virginia Lee, co-director of Cedars Cancer Support, manager of the MUHC's Supportive and Palliative Care Program and Services. And Virginia, if I can here, and I will at the end, thank you for putting this incredible program together. Dr. Virginia Lee.
So good evening, everyone. Hello, everyone. Can everyone hear me? Because I have a low voice. Not practicing as well as Jeff here.
We hear you.
So bienvenue à tous ceux qui sont ici dans la salle et ceux en ligne. J'ai le plaisir de présenter aujourd'hui le thème des 3 prochaines années de la Journée mondiale that serves as a powerful reminder that we are all in this together. That this is a global initiative, no matter if we're here to as people, as persons in our family, in the community, at a higher level, at the provincial level, or even beyond. This impacts all of us. And as Jeff mentioned, we've been doing this at Cedars Cancer Port for a long time. And this is global. So this is a map of activities across the world, showing all these activities. Today, there are 362 activities, and I don't know why they're all not popping up across the world, but there are 362 as of this morning, and I'm sure there's a larger movement. Everyone's talking about cancer and the unique theme that we have this year. So 364 and more, and this is just to show that I just took little screenshots. There's that we are part of this global initiative. So the theme for this next 3 years is called United by Unique. And I have to be honest, when I saw that theme title, it took me a little bit of time to wrap my head around it. And the reason is people usually unite because of similarities, of things that are similar together. We share things together and we group things that are similar together, that are in harmony or in agreement with one another. So being unique means that we're different. And so how do we reunite each other when we are different? Differences separate, but sameness unites. So this campaign is really calling us to really challenge our beliefs. It's really going to be a difficult journey to put this together because we are all so different. So how do we recognize everybody's differences and how do we unite all of us together? And World Cancer Day is proposing that we share our stories. So every story is unique and it takes all of us to create this world where we look beyond the cancer diagnosis and the disease, and we look at each and every one of us differently and the unique person that we are. And then my background as a researcher is in existential concepts. So I really gravitated to this. The concept of uniqueness is very curious. And I wanted to share with you where do we find our uniqueness? Why are we unique? So according to the existential theorists, our uniqueness, and therefore what makes us different, comes from 4 different givens of human existence. Being unique means that there's only one of each of us. There's no other person like us. And that means that we are essentially alone and that we exist in isolation. If you think about it, we entered the world alone. Our lives, our existence, our stories, they began on our birth date. And this is really something to be celebrating. Some of us celebrate the same birthday, but how we came into the world, completely different. Just ask your moms, your mothers, what happened leading up to that day that you were born. Everyone's different. I have 3 kids and every one of them like to hear how each of them were different and how they were born differently. The second given seven given of human existence is death. Each of us will leave this world differently and uniquely. There's 100 certainty in death and 100 uncertainty about how we will leave and how our lives will end. The third aspect that makes us unique is freedom. And we each have that free will to make choices, and then also the responsibilities and the consequences that come with those decisions that we make. Sometimes those decisions are difficult to make, and therefore that creates some struggles. And then the fourth aspect of our lives that makes us unique is that we each have the capacity to see things and interpret and appraise different events differently in the way that we understand it because of the way that we lived our lives and how we grew up developmentally. So we make sense of everyday events differently. And that, therefore, our stories are being written each day. And I call this process becoming. It's a process of becoming who we are. And we kind of know this intuitively because when our kids are small, we always ask them, what do you think you're going to become? What are you going to do when you're going to grow up? Then at the age of adolescence and young adulthood, there's all these movies and stories about coming of age. But really, there's no end point to growing up. Just because we're older, we reach a certain age, doesn't mean that we stop becoming a different, better version of ourselves with each milestone, with every day, with each event. And with reflection and contemplation, we still are becoming a different, better version of ourselves. It never ends. So I like these clouds because it gives us a great metaphor to our life's events. And I'm sure you've watched the clouds on a windy day. The clouds, like our life events, they roll in, they change shape. The winds come in, they take a different form. The same cloud, they have a different formation, but everyone looks at that cloud and sees something different. That's the way that's our meaning that we give to those clouds or to our life events. And then the clouds disappear, and you have clear blue skies, and then the clouds come back, and the world looks different again. And so here's a curious fact. There's something on Facebook called Cloud Appreciation Society. So if you're interested, that's like a great metaphor to life's events. And there is another saying about clouds and the winds. We don't know which way the wind is blowing from one day to the next. So life comes with a lot of uncertainty as well. We know that the weather forecasts aren't always right either. So unexpected serious events like cancer and other forms of life adversity can find their way into our life narrative. And there are things that are out of control. Personal stories like cancer are difficult to share because they make us feel vulnerable. And these cancer stories remind us that life is different. Once a story is told, have you noticed that people might treat you differently? Or they see the cancer first before they see the person now. So people may not feel like they're heard, seen, or understood when they have a cancer diagnosis because the cancer becomes what's in the foreground. And there's a lot more obstacles to overcome. And that's the overcoming kind of overshadows the becoming of who we are. And that's what we're trying to change with our stories. The act of becoming, we don't want that to be overshadowed with all the obstacles that need to be faced with a cancer diagnosis. So the World Cancer Day theme is calling for us to share our cancer stories. This isn't always easy. It's not. It leaves us feeling uneasy, vulnerable, perhaps exposed. We don't know how the other person will respond. Many are uncomfortable. And even the whole field of psychosocial oncology, it only came into effect in the 1980s. And prior to that, cancer, the C word was never uttered. It was really kept in the dark in the healthcare setting. I wanted to share my mother's cancer story with you, and I really struggled about sharing or not, because and I struggle with this cognitive dissonance because I grew up in a household where our family stories, they're they're meant to be kept private. And then my training and all my research suggests otherwise, that we're supposed to talk about our stories and share and form connections. So to this day, my mother hid that she had cancer. She didn't want anybody to know. And to this day, we don't talk about it in our house. My father denies there was cancer that happened to my mother. And for that reason, I have a blank slide. What I will say is this, my mother's cancer story quite began by chance. I was in my first year of my PhD. It's a fall evening when I wanted to explain to my father why he needed to be investigated for this large growing mass in his neck. And he needed to go and see the doctor because every time he turned his neck, he would lose consciousness. And that evening, my mom casually mentioned to me that the skin on her breast was puckering. And when I examined the skin, that was the beginning of my mother's cancer story. And she had surgery, chemotherapy, radiation therapy. And ironically, that was the end of my father's cancer story because he adamantly refused to go see an oncologist for himself. So for many of us, remembering our cancer, how cancer entered our life narrative is life stopping and life changing. And I've heard a lot of people how they talk about life before cancer, life after cancer, and that becomes their life narrative. And then I want to now to go back to normalize why our cancer stories are difficult to share. And at the same time, why they need to be shared. and hence a theme for this World Cancer Day. Cancer stories are uncomfortable because it's like a toothache that has an exposed nerve, and life threat that's uncovered by a confrontation with our mortality, with a cancer diagnosis, touches on those big questions that I talked about, the four givens of existence that I listed earlier. When life is good, these four givens of existence are not bothersome. We all know this on an intellectual level. But when cancer or serious adversity enters our own narrative, suddenly these four truths about existence start to matter in a big way. There's a need suddenly for a sense of connection, to be seen, to be heard by others. There's an intense need to survive, a will to survive. Time becomes more pressing, and it's perceived as shortened, and there's not enough time to do as much as we wanted to do when prior to cancer, the diagnosis. There's an increasing need to fight to maintain our independence and autonomy and the ability to make and the freedom to make decisions. And lastly, cancer and serious illness raises all sorts of existential questions about whether or not there was meaning and purpose in our life. Did I matter to anybody? If I died, will anybody miss me? So all these questions come to the forefront. They are raised by a cancer diagnosis. And that leaves us feeling so vulnerable when we talk about our cancer stories. And these questions get louder whenever there is stillness. But cancer makes us feel like we're free falling with no safety net, no parachute. So in a previous talk I gave about being still, I talked about how the awareness of death can paradoxically lead to this awareness of light. And being still is kind of like parachuting. For those who have parachuted or skydived, there's this period of time while you're suspended in sky and there's total and utter stillness. And you're able to look around, you marvel at the vastness of the earth. You see the colors, the horizon, you feel alive, you have a sense of clarity and freedom, and you experience the wonder of your place in this universe. And then you also know that you're free falling. And because of that force of gravity, and you hope for the best outcome on your journey downwards. So this is a pivotal turning point towards awareness of death. We have this opportunity now to re-examine our life in a review, beliefs about that are handed down across generations, developed over time with our busy lives, and that were unquestioned perhaps until now. And there's a stillness to pause. This gives you an opportunity to pause and look back, to listen and to hear what truly matters, what's really important for you. So this awareness of finiteness of life allows you to live more fully. It gives you more agency to decide what you want to do, how you want to spend the rest of your days. You always had this, but now with this awareness, you're able to make those decisions. You have permission, you're giving yourself permission. And that propels us to use the remaining time to express love, to connect with others in a grander scheme of things, and to recognize choices. So the truth is that we're all in free fall. The cancer diagnosis or if any other serious life-threatening event, it gives us a catalyst to get us talking to each other. It acts as a catalyst to get us back on track to who we want to become. And this sense of vulnerability, paradoxically, simultaneously also gives you a chance to be bold, to face each minute lived with the realization that the story might change. The clouds will pass and it will shift. Taking the risk and sharing your story will connect you with other people who are pondering and confronting the same big four questions. And how many times have we said to someone, I don't know how you do it, when they shared all their life challenges with cancer treatment and everything else that they're trying to struggle to put together and keep normal in their life. Others will see and reflect your courage at a time when you feel more vulnerable. And the fact is, we all need each other. The stories we tell each other are impactful. And these stories do not need to be told in confidence only to a family member, close friend, psychologist, social worker, nurse, doctor. I've heard stories that are just as impactful and powerful because they were shared amongst blood takers, with the administrative agents, with the security guard, the volunteers who are around cancer center, in our cancer center, the person on the other side of the phone who's taking your appointment. They listen with understanding and reassurance. And the staff at the cafeteria, when we go and get a coffee, they're there to listen. I don't know how many times I've heard stories about these great people who are there to listen. So it's that courage that we need to share our stories. We need to free fall together by sharing our cancer stories. And we may each start with a different cancer story, but through sharing, invariably, we're going to find out that there are more similarities than differences. And, you know, when we put together programs about peer group support and we want to organize it by type of cancer, in reality, it's not the type of cancer that's going to connect you. It's the life stories that you're going to share. And it's the impact that cancer has had on your life. And that's what we all share. It's our life experiences. So at Can Support, we offer a lot of different programs, activities that facilitate sharing stories and activities to connect people. And we provide that opportunity. We have structured events, structured programs for people to connect. We have peer support groups, creative writing, art therapy. We have a new bereavement walking group. The complementary therapists are there, the volunteers, the teams in our resource center. We're all there to listen to your stories. And then also here, there on a more global level, on the World Cancer Day website, there are opportunities across the world to share your story as well. And you'd be surprised at how many people are there to share. There could be patients, there are politicians, there are doctors, nurses, everybody sharing their stories. And at last count here, there are over 1,000 stories and counting. And storytelling, it's not just a good story to share. There's substantial research on the benefits of storytelling, which I'm not going to go into here, but it allows emotional expression and processing. It allows complex emotions to be structured and to give a framework so that these overwhelming experiences can be understood and integrated in a manageable, more hopeful way. It allows people to create meaning. It gives you it reintegrates a sense of identity and purpose in times of transition and uncertainty. And there's collective healing to be had from that. So in summary, the research consistently supports that the idea of storytelling can be a powerful therapeutic tool. It allows the patients and even the listeners to co-create and to help each other, I guess, adjust and co-create and heal with each other during a cancer experience. And so to conclude, we choose our own path. We make our own choices. Nobody wants to feel vulnerable when they're opening up and telling your story. It's a personal choice. You determine whether the right conditions are there to share. You determine if there's adequate time, respect. There should not be any judgment. There should not be any interruptions. There should be compassion, empathy. There's no expectation to fix anything. We're there to listen. As a story to be told and to be listened to be curious, to be still, and then to be courageous in someone's vulnerability. So sharing allows you to understand what's happening in your life, and it can lead to different conversations about what's important, your goals, your aspirations, your hopes. And this is really important for the physician or your healthcare providers because they then can adjust treatments and adjust to the treatments plans for you. So I guess to close with my mother's story, both are still alive, my father and my mother. It's been 25 years since my mother's cancer. We still never talk about the cancer. And just like other traumas she's lived through, she made a choice to keep these stories to herself. My father's cancer story turned out to be a benign tumor that he still lives with, and it's untreated. So there is hope. And when a cancer diagnosis is there, we never know what will happen, but we need each other to support each other to move with the wind and as things change. And these are the choices that they make. And I hope that, you know, we respect each other and the stories that we share with each other. Thank you.
Thank you. Thank you, Dr. Lee. Thank you, Virginia. Great pleasure, ladies and gentlemen, to introduce our next speaker, Dr. Peter Matrakos, Director of the MUHC's Hepatic, Pancreatic, and Biliary Surgery Program, world-renowned surgical oncologist, and a great friend of the Cedars Cancer Foundation. Peter?
Thank you. Thank you for Virginia for actually encouraging me to come here. This is actually out of my depth. I usually give talks about some sort of clinical innovation or molecular biology of cancer, but this is more of a psychosocial circle, and it's really something that I don't do. So immediately my thoughts were, let me do some research. Let me go to PubMed and put in person and all this that we're supposed to do. So I actually resisted that because I figured I think I've had good relationships with my patients over the years. So I thought I would do this sort of exercise where, what is it that I do? And I'll describe what I do. And then I'll look up the literature and see if actually, intuitively or through experience, I've been doing this for 25 years, have I come to the same sort of result that people have written about. Also, full disclaimer, I've had no surgical oncology training, despite what Jeff was saying. I'm a transplanter by training, so I've transplanted, pancreas. I've done pancreas transplants. In fact, that's what I initially did when I got back from Minnesota, and kidney transplants and liver, which is my. This is what I do mostly now, is a liver transplantation on the transplant side. But as I was doing these things, some people along the way sort of nudged me in the oncology direction. So the first, and I think many people will know him, is Adrian Langleben. So he encouraged me to apply my liver skills to colon cancer liver metastasis. And that has become sort of pivotal in what I do over the last 25 years. I mean, that's what I'm known for mostly. And then Yogesh Patel, who was the director of endocrinology here, he called me out and encouraged me to work on neuroendocrine tumors of the pancreas. And again, that has led to other, I think, successes within our group. And lastly is Peter Cavan, who he and I started the hepatopancreability tumor board many years ago. And we spent roughly 15 years together before we got separate. I mean, we still talk to each other. We still refer patients to each other. He's at the Jewish General now. And he taught me a lot about oncology, chemotherapy, and so on. But on the patient side, I mean, there are stories that there are things that on the oncology side that a person with cancer or a patient with cancer offers that I don't get from the transplant side. I don't know, it's difficult to describe, but I've really made some amazing friends on this side of things. I mean, one in particular, I took care of him for 7 years, and he was an avid golfer. So I had to arrange all his treatments around him playing golf, which is fine, So, I see them argue with his wife, you can't do that. You can't play golf and not get treated. And I said, look, what's the point then? If we're, why are we doing all this? Right? So, and we actually, they were always up for innovative treatment and so on. So the last, I actually is still very good friends with his wife. He passed away 7 years after I started treating him. And he was at the old Ross Pavilion at the old Vic, in one of the private rooms. So I was, it was fall, I had a trench coat on, and on the way out, because I used to park outside the Ross Pavilion, on the way out, I went to see them. And I said, "Hey, how you doing, guys?" Whatever. And they were sort of having little pate and little crackers and whatever. So I jokingly said, "So where's the wine?" They said, "Well, we can't have wine in here." And I said, "Just give me a sec." So I ran back to my office. There's always like 10,000 bottles of wine because all my liver patients think that they need to give me wine. Anyway, so I I put a couple of bottles of wine in my trench coat. And I went back, opened up, and we had a bottle of wine together. And this was about a couple of months before he passed away. But a great guy, and I could tell you so many other stories like this. And I mean, one of the things I always tell my patients are that they tell me, "Well, who's going to follow me?" I said, "Listen, we're friends for life now. We operate on somebody, we stick it out. We're going to see you every 6 months for the rest of your life." And and I do get to know them quite well, and sometimes, especially if we have something in common, if they cycle, I cycle like mad, so we start talking about bikes, and we start talking about gears, and what's going on, the races, and so on. Greek food is always a big plus. Yes, if we start talking about food, that's great. So anyway, all that to say, that for some, I mean, I've always been like that. So the person is important. And our cancer patients, our patients with cancer, are basically a section of the population, and they represent all kinds of people. So the people that in your life, the people that you meet when you go out, when you travel, and so on, it's the same people. It's just a segment of that population that unfortunately have gotten cancer, and you get to interact with them. And it's no different than when you're interacting with somebody that you meet somewhere else besides your office. So I started to think about, oops, sorry, how do I get back there? So first of all, full disclaimer, I mean, this is what I do. I do serious stuff in terms of, what the outcomes are. So we do liver cancers, primaries, the rise in the liver itself, the hepatocellular carcinoma, intrahepatic cholangio. And the biggest metastatic tumor that I treat is colon cancer that's spread to the liver. And we do periampular cancers, which means that there's an area between the pancreas and the duodenum, that's the ampulla where the bile flows, and the pancreas juice flows into the duodenum. And there are tumors that surround that. So you can have a cholangiocarcinoma, ampullary tumor, duodenal carcinoma, and of course the almighty pancreas cancer, which we're having a lot of difficulty with. So these are serious diseases, and if you put it all overall together, the patients that I can actually operate on and treat, my success rate is 25%. That's the patients that I can actually cure. So it's serious stuff. So patients come. They're already, some of them are on the internet already, and they don't quite get what they've read, but it sounds terrible. So already they're in a bit of a panic when they show up, and others don't quite get it, that they have a severe problem. Let's just get it out, and it'll be okay. And so there's a dichotomy, and there are people in the middle, of course. So you got to figure all this out. Otherwise, you can't take care of the patient. So how do I have to figure out how to communicate with them. So, and this is really before I've read anything, and because it kind of, when you read the literature on this, it kind of copies this, but I actually wrote this down before I read anything. So I want to figure out who they are. That's the only way I can communicate with. That's what I do when I meet somebody anywhere or somebody introduces me. So I want to know who they are, what's their education, what's the family situation, is there support around them, what's the situation there, what are their habits, bad habits, good habits, the whole deal. I mean, and what are their resources? So that's their social context, and then I can actually interact with them on that basis. And then, of course, there are their own individual characteristics. What are their values? Are they extroverts, introverts? So if they don't talk to me a lot, is it okay? That's the way they always are. If they talk to me a lot, is that okay? Because they'll change. If they're stressed, it's going to change. So I need to know where they're set. And some patients want a lot of information. Virginia was talking about her family situation where they don't want to talk about things. Well, not everybody needs to talk about things. Not everybody wants to do this. I could tell you a story when I'm from Southern Peloponnese. I'm Spartan, and when my wife and I got married, before we went on our honeymoon, we went to meet each other's families. So she's Kalamata, I'm Spartan, so we went back and forth. And of course, if anybody knows what happens down there, there's entourages that develop and they follow you around. So there's this sort of a couple in their mid 40s, I think, and we were in our late 20s. So I noticed that the husband, I was just finishing medical school, so I thought I was bright. I noticed that the husband was coughing blood every so often. His breathing wasn't great. There's a few things that I noticed. He's lost some weight, it looked like, and so on. He wasn't eating well, and whatever. So I pulled his wife aside and I said, listen, I said, there's something wrong with your husband. I mean, I kind of questioned him. I go, he's a heavy smoker, so lung cancer is a good possibility the way he's behaving. And she says, oh yeah, we know that, but don't tell him. It's gonna upset him, and he's gonna be totally different. I mean, that's not what I was trained to do, and even by my last year in medical school, that's not what I would do. But I think we have to be sensitive to all this. We can't just do whatever we think we should do. We have to figure out how to bring everybody in. I mean, one of the ways I do this with some, because my tribe does this still, and there are other ethnic groups that still want to do this type of thing. I mean, one of the things I try to tell them is that, look, in the course of your loved one being treated, they're going to encounter all kinds of people throughout this hospital. Somebody's going to spill the beans, and it's not going to be nice, because they're going to be clueless. I mean, in part it's clueless, but also they're denying it, right? I mean, there's a bit of a play there. So slowly we introduce the concept, and I don't force the issue on those things. I try to introduce the concept over several visits and so on, and bring it around. Anyway, just to point out that there are just different ways of doing things all over the world, not necessarily right or wrong, but different. So then, so that's kind of how I figure out how to communicate to these patients. Now, so communication is the key, right? So now in my head, I've kind of figured out how I'm going to talk to different people. Some people, prefer straight. Some people prefer, a little piecemeal humor. There's different ways of doing this. So, but when you get a call with any of these diseases, you have to see the patient quickly. So I have 3 days a week that I can see new patients, because somebody tells you got pancreas cancer, you can't wait 2 weeks. The patient and the family is not gonna survive that kind of stuff. you have to explain the disease. I have, diagrams in my clinic walls, whatever, so that they can get an essence, not just from the computer screen, but also be able to kind of touch the paper and whatever, and use props. I have some, molds of liver and pancreas and so on. They need to get a feel of what's going on, and I think that gives them a little bit of ease. You often, it's more often than I ever thought would happen that people come alone. I never in myself, like if I ever had a problem like that, I would never in my life go anywhere alone. But some people do, and it's either they don't understand the level, how big a problem this is, or they don't want to. I don't know. Different reasons for different people. But I do encourage them that I will not operate on people if I don't meet the family and discuss it with everybody. And there has to be that level of support and that level of interaction. And it always turns out better that way for everybody. Diagnostic tests, treatment, surgery, and chemo with timelines, followed by answering questions, modifying strategies and timelines. That's so important. They have to know where they're going. They have to know the trajectory. They have to know how long. It all settles everything down, and people in general do better with all that. So, and then ultimately we talk about work. Many people think that they're going to continue to work during this treatment process. In what I do, most of the tumors are best treated by surgery and in combination with chemo. So both together. So that's minimum 8 months. Minimum. Without any complications, without anything. If you get a complication or whatever, we're talking a year. And I don't know that. I usually encourage them not to work during that time and do whatever is necessary, whatever paperwork, and that's really important that we kind of settle that up front. Otherwise, they won't want to do this. The other issue is chemotherapy. Like many people are at first getting chemotherapy. So, well, doc, take the tumor out, and then I don't know, we don't need chemotherapy. And like I said, like often if I feel that the combination is what's best for them, you got to just take the edge off and say, well, look, it's not a contract. You try it once. If it's not that bad, then you can continue. It's not like you sign a contract and you have to do 12 cycles or we take away your house or something. It doesn't work that way. So these are the type of things that I'm allowed now to communicate once I know who they are. Regular follow-ups are important because everybody wants to know where they are and how they're doing. And we do discuss a lot of other things besides disease and treatment. So whatever they do, I want to find out what they do. I want to find out what they're, what it's all about, what else they do, their kids, it just, that's the way I function, I guess. And I think it's a good way to function. And humor where it's allowed. There's no better way to get through the day. So so this is my little exercise. So I went through all this, and then I went to I guess this is the New England Journal Catalyst and patient-centered care. And if you look at, I think I hit most of these little blue circles on it. And I read further. I read the article, so just to put because I don't have the lingo, for this type of thing, because I haven't really, it's not my thing, or I don't study this thing, so I don't have the lingo. But I think that I think that many physicians will find that they actually do get into this, even though they don't have the structure that you actually define it with. So I think we're done here. Thank you.
Thank you, Peter. Thank you, Dr. Matrakos. Thank you for the humanity in what you do every day for our patients. Ladies and gentlemen, Notre prochain conférencier est le Dr Mark Hamel, directeur du programme d'oncologie psychosociale du CUSUM. Mark is our director of psychosocial oncology and such an important, vital member at the Cedars Cancer Center. Dr. Hamel.
Merci. So I have the lingo. So I will talk to you as a clinical psychologist. Merci au Centre des Cette, merci la Fondation, merci à tous d'être venus, les gens qui nous rejoignent par vidéo. Je vais vous parler de l'espoir. Donc, quand Virginia s'est approchée pour me demander de quoi j'aimerais parler, la première chose qui m'est venue, c'est de vous parler de l'espoir. Donc, j'ai intitulé ma présentation comme suit: s'appuyer sur l'espoir, surfer avec l'incertitude. I didn't know surfer was a French word, but it is. So I call it in English, leaning into hope, riding the waves of uncertainty. So I've been a clinical psychologist working in oncology for 23 years now. Ça fait 23 ans que je fais ça. Avant, je travaillais dans le VIH-Sida. Donc, ça fait plusieurs années que je travaille dans le milieu de la santé. Et j'ai décidé aujourd'hui de vous emmener, bring with me all of the special stories I've heard, inspirational stories. I'm just going to share some of them. I've changed some demographic variables just to preserve confidentiality, because psychologists were very special with that. So these are real stories from Mid-Minute. So I've had a 50-year-old man diagnosed with inoperable stage 3 lung cancer. Began chemotherapy and immunotherapy. 5 months into treatment, person is a potential candidate for surgery. Another 59-year-old man diagnosed with stage 4 pancreatic cancer in 2021. Person had a Whipple surgery, chemotherapy, radiotherapy treatments. In 2025, this person continues to work and travels. Il y a aussi une femme de 50 ans diagnostiquée qu'un cancer du poumon avancé en 2021. Elle a eu les traitements de chimiothérapie et la radiothérapie. Elle communique avec moi toujours, à chaque période des fêtes. Elle m'envoie un petit courriel ou m'appelle pour me dire comment elle va bien. Il y a un autre homme de 64 ans diagnostiqué avec un cancer colorectal. Il est admis à l'unité des soins palliatifs pour le contrôle de la douleur. Lors de son admission, la probabilité que cet homme puisse rentrer à la maison est jugée peu probable. Une semaine plus tard, sa douleur est bien gérée et il a pu rentrer chez lui pendant quelques jours, passer du temps avec sa famille et gérer ses affaires. Une autre histoire, un homme de 27 ans, 27-year-old man, diagnosed with brain cancer in 2020. My psychotherapy with him focused on helping him cope with losses, his work, and face fears about him dying. A few years later, he informs me that he's a proud father of a baby boy. And there are many, many other stories and other stories to come. So I use this as my foundation to talk to you about hope today. We know that cancer survival has increased since the 1990s. Today, Canadians facing cancer have a greater chance of surviving than ever before. Statistics Canada, according to recent statistics, the 5-year survival of all cancers combined has increased from 55 in the early 90s to about 63% today. When we look at the 1940s, the survival rate was around 25%. So there is hope. But why do we worry? When someone is diagnosed with cancer, why is there worry? I tell my patients all the time that uncertainty is the cause of worry, is we don't know what's going to happen. Thank you, that was great. So it's because of the uncertainty. So worry, when you think about it, it's a human condition. We all worry. It's part of who we are. When we were cave people, when we're going out, we had to worry. Anxiety was serving us to make sure that we can decipher danger. So worry is natural human response to the unknown, to uncertainty, because all humans desire control. We all desire security. We desire predictability. And we desire certainty. So Virginia talked to us about uncertainty. So it's a natural and it's unavoidable. Once we start to accept that, understand that, because life is unpredictable. I'm going to give up my age here. Does anybody remember this book, The Road Less Traveled? This was 1978. I love this book because I don't know if you remember the first line. Life is difficult. It is great truth because once we truly see this truth, that life is difficult, we can transcend it. Another book that I recommend to all of my patients is The Happiness Trap by Dr. Harris. So he talks about the very purpose of life is to seek happiness. We always want to be happy all the time. However, like all human emotions, feelings of happiness don't always last. Stuff happens, don't be polite. So sometimes life gets in the way. Cancer can get in the way. And what are the sources of worry? I'm sure I'm not teaching anything new, but let's talk about them. Will the treatments work? Can I hope for a cure? Will the cancer come back? If so, when? Will my fatigue go away? Who will be there for me? So Dr. Matrakis was talking about social support. Will my concentration ever return to normal? That's a common worry. How much pain will I be in? Will the pain be well controlled? Will I be able to go back to work? How much time do I have? Will I be able to have children and a family? Will my family be okay? And others. So these are common worry that people express to me in my office. I put an asterisk beside them. Does anybody know why? I did not.
Variable to patient.
It's variable to patient, good. I also don't want to forget the family members. So the family members also share the same worry. So uncertainty, one of the most common one, the most probably prevalent one, c'est la peur de la récidive. An early review indicated that approximately 73% of cancer survivors have some degree of fear of cancer recurrence. 49% report moderate to high levels. A recent study found that 19%, 19.2%, of persons with cancer rated their fear of cancer recurrence as severe. Another interesting study, speaking of caregivers, approximately 50% of them experience levels that are either equal or greater than those reported by cancer survivors. So when we talk about cancer experience, we also have to include the caregiver, the person closest to them. So fear of cancer recurrence is quite prevalent. And I come back to, I like books, and I come back to the Dalai Lama, who really taught us about uncertainty or humans' relationship with uncertainty. And I took out these two quotes. People would like to be able to take a pill that makes their fear and anxiety go away and makes them feel immediately peaceful. Just give me the pill, I'll be fine. This is impossible. We must develop the mind over time and cultivate mental immunity. Hope is the antidote to despair. L'espoir nous aide à gérer le désespoir, la détresse. So why talk about hope? What's so great about hope? Well, there are studies that support that. Hope benefits well-being. It promotes happiness, life satisfaction, meaning in life, relationships, and belonging. Hope also benefits mental health. It promotes coping with loss, chronic stressors, resiliency to trauma, resilience to loneliness and lack of social belonging, and mental illness recovery. Finally, hope also is good for your health, promotes health goals, preventative health behaviors, and adjustment to chronic diseases. When I was searching this, the other thing I learned is hope is good for the brain. So experiencing hope dampens the anxiety circuits in the brain. I didn't know that. So I must be full of brain activity. So when you feel less anxious, your brain functions better. It improves. And when we focus on hope, there are other several areas in the brain that are also activated. The prefrontal cortex, which is responsible for decision making, and the neurotransmitters. So dopamine, serotonin, which is involved in the pleasure centers, makes us happy. What about hope in cancer? What does the research say? Well, there's quite a few. So hope is really good for physical, social, and mental health outcomes, and because it promotes resiliency. Hope is good for your improves quality of life, social support, spiritual and existential well-being, resilience, life satisfaction. It helps with post-traumatic growth, so it helps you grow as a person. It can reduce symptom burden, psychological distress. It can decrease depressive symptoms. It can increase survival. There's some studies supporting that. And it can reduce pain perception. So there's lots of benefits of hope. So the other thing is that, well, what do we mean by hope? What does hope mean? So hope really is it's a desire with anticipation for something. I want something to happen, something true to happen. I don't know if any of you use ChatGPT. I just started using it. I said, you know what, I'm just going to plug it in and see. Well, I really like the definition. So he talks about a mindset that anticipates good outcomes despite uncertainty. So it took the Dalai Lama's definition and plugged in uncertainty. So I'm quite impressed. So I might use it again. So this is the juice of my talk, is the following. So in my office, I love using metaphors. So Virginia talked about use some metaphors of the clouds. I use this with my patients all the time. The image of the surfboard. Funny thing is, I can't swim. So I don't know where that came from. So if you look at life events as the waves, so things happen in life. Sometimes the sea is very quiet. Sometimes things happen, there's a bit of waves, and sometimes there are huge waves. And sometimes it's going to throw you off the surfboard. The surfboard is our anchor, right? So that's what we want to hold on to. And then there's the leash, right? It's how we say it, the leash, and the rope. So we're always attached to our anchor. So we can fall off, but we can still aller chercher le surfboard. And when you think of it, it's not how one falls, because we know we're going to fall. We know there's going to be waves, but it's how we're going to get back on it again and again and again. So let me share with you, how do we maintain hope? And this is some of the reflections I've had when preparing this talk. Je vais le traduire en même temps. Donc, comment maintenir l'espoir? Ask questions to your medical team. As much as you want to know what you're facing. Acceptance is about meeting life where it is and moving towards what's important to you. Donc, de poser des questions avec votre niveau de confort. Remember, acceptance is not resignation. How often I hear this, I cannot accept this. I will never accept this. C'est impossible pour moi d'accepter le diagnostic. So remember, acceptance is not resignation. Acceptance doesn't mean that we must like the facts. Remember that denying facts will not change it. Accept your emotions and your experiences for what they are without judgment. Is that okay? C'est-tu correct comment je me sens? I shouldn't feel this way. Everybody says I should be positive, positive, positive. Well, sometimes it's okay not to feel positive. It doesn't mean that you're giving up. C'est correct. Vous avez le droit de pleurer, vous avez le droit d'être en colère. You need to own that without judgment. Fear is a thought, not reality. Think about difficult times you've experienced in the past and how you surmounted them. You come with something. Your board is there. You've built that board over the years. Contrôler ce qu'on est capable, laisser ce qu'on peut pas. Control what you can, let go what you cannot. Viktor Frankl, everybody knows the book Man's Search for Meaning, Experience of the Holocaust. Wonderful book. And he talked about searching for meaning and purpose. That's really, really important when we feel we're losing hope. So what is still meaningful in my life? What's purposeful? I really like this, is to accept that at times there are no clear answers. You don't have to know everything. It's okay not to know how I'm going to deal with this. That's okay. Sometimes we need just to pause, wait for the wave to pass. Just when you fall off, it's okay just to float in the ocean. Get your cord and bring your board closer to you. And maybe sometimes you just need to lay on it for a while. And that's okay. Celebrate victories. So once chemo's done, celebrate that. Yeah, but there's radiation and then there's surgery. Celebrate the first milestone. It's really important to celebrate. And there are no such thing as small victories. Practice gratitude. There's studies showing that journaling, putting thoughts and emotion, your experience on paper really is beneficial for your mental health. Pratiquer la gratitude, garder un journal. I'm a big believer in joy. Do things that bring you joy. Yeah, but I don't feel like it. Appetite comes, l'appétit vient en mangeant, right? So what I like to do, I like, especially in the spring, I like to buy a little bouquet of flowers once a week. To me, that's my joy. Simple things like that. It can make a difference. Focus on the present moment. Remain in the now. Can't control the future. Not always. Can't change the past. Practice meditation daily. La méditation, de plus en plus de recherches qui démontrent à quel point ça l'aide avec l'adaptation. Have faith in yourself. Believe that whatever happens, you will find a way. It may not be in the manner that you think, but you will. Vous allez trouver la réponse. Des fois, c'est pas dans la façon qu'on pense qu'on va le trouver. Hope grows. Remember that hope grows. The more you feed hope, the greater it can grow. Virginia talked about connecting with others. Stay connected with people. Communities feed on hope. This is a community. Here at the Cedars Cancer Center, it's a community. Seek help from services. I'm going to plug in my program. So we have here the MUHC psychosocial oncology program. So we have mental health professionals who can help you and family members navigate, surf through the waves. There's Cancer Support, of course. We're great. We work along with them, and Cedars, of course. So seek help, especially if there's not a lot of support around. And probably the most important thing and the most difficult things for any human is tolerate the uncertainty, right? Is to ride the wave. And sometimes you fall off, that's okay. To live is to be side by side with uncertainty. And because fear of cancer recurrence is such a huge concern, here at the psychosocial oncology program, we've started a new group, a new service, 6 weeks of group therapy to help people navigate fear of cancer recurrence. Anyone's interested, you can reach the extension 45502. Remember the stories at the beginning? I invite you to add your own. So add your own story here. So for those who know who Ted Lasso is, I believe in humor. Some people who know me, like to use humor a lot, but I always tell my patient, I believe, I really do, you never know. And like the stories in the front, in the beginning, you never, ever know. And I believe that. Merci.
Merci, Dr. Hamel. Mark, to you and your team, écoutez, ladies and gentlemen, the PSO, the psychosocial oncology team, the group of women and men that work with Mark and our patients day in, day out. A shout out to all of you. Merci, merci, merci. Ladies and gentlemen, I am delighted to introduce our next speaker, Teresa Diodati. Teresa is a patient at the Cedars Cancer Center, and we're incredibly grateful to you tonight to be with us and with your family as well. Teresa will be sharing her own unique story and talking about who and what has helped her get through it. Merci de partager votre histoire de résilience et d'espoir avec nous. Teresa. Click the button.
Good evening, ladies and gentlemen. My name is Teresa Diodati, and I have cancer. I'm honored to be here tonight, standing in front of you all, sharing my journey and my story, along with all the amazing care I have received here at the Cedars Cancer Center, which I happily call my second home. This year makes 11 years that I have walked through these doors, sometimes once a week, sometimes once a month. It feels so much like home that I know where everything is, even though I don't know everybody's names. Just seeing the familiar faces and sharing a smile gives me warmth and the courage to deal with. Because I know deep inside that I have the best possible care here. I'm truly glad that I feel at home here. Otherwise, this journey would be very difficult for me to deal with. Which gets me to the next point. I really believe the first most crucial step in fighting cancer for any patient is to feel comfortable and at ease with their doctors, nurses, hospital throughout their journey. So, when I first arrived here and till today, this is how the doctors and nurses describe me. But this is me describing myself to everybody else that I meet, because I still don't know everything. I still don't know how to say any of this. But I'm sure patients and doctors here can relate, because I'm sure patients relate to this. Now let's talk about my journey. My journey started in 2013 when I visited my doctor, my family doctor, because I had a lump under my right armpit. She said it was nothing and scheduled me for a mammogram. In early 2014, I had done my mammogram and was told that if we don't call you, all is good. So I went about my daily life, working 7 days a week, being a mom and a wife. In May in 2014, my husband and I had scheduled to go to Florida to renovate one of our kitchens in our house. So understandably, leading up to this trip, I worked 20-hour days, didn't eat much, to ensure that my family and kids were looked after and that the company we ran would run smoothly for a week. Once we arrived in Florida, we both crashed and slept for 24 hours straight. Upon waking up and showering, I noticed that my right breast had shrunk, but I brushed it off to not eating over the past 24 hours. During that summer, I stumped my toe on a piece of metal and it was not healing. So I decided to go to the walk-in clinic in the West Island. I went day after day after day, being turned away that there was no room. Then one afternoon, I got upset with the poor receptionist and almost cried in despair, and she was able to find me a slot. While she was taking my information down, I had mentioned to her that I also wanted the doctor to look at my breast, as it was looking a little odd. To which she replied, "The doctor has no time for two issues. You need to choose either a breast or your toe." Therefore, I decided on my own, because I was traveling to Italy in September, that I needed to address my toe, because I had to wear high heels in Italy or else I was not going. So that was not going to happen, I told myself. So in I went and met Dr. Dunrymple, a lovely lady. To this day, I think she saved my life, because not for her, I would be in Italy that fall. She looked at my toe, tried to figure out why it wasn't healing. So in my head, I thought, now is the time to address my toe. Politely, I asked her if I could address another health issue, and she replied, "Of course." I removed my top, showed her my breast, and I still remember her face. She was scared for me. She took out her pad and with a shaking hand wrote down that I needed a mammogram, a biopsy, and if all was negative, please pursue further. She told me that she would make all the arrangements and to stay by the phone. Leaving there, I knew it was bad. I thought, why was her hand shaking? But it couldn't be. I just had a mammogram and they didn't call me back, so it meant everything was good. Why did she write, "If all negative, please pursue further"? I got in my car and made that dreadful call to my husband, explaining to him what had just happened. He was so supportive and still is very. Once all the tests were done and they had all come back negative, they decided to do another biopsy. And that's when they finally located the cancer. It was so big, it was hiding behind my breast. I was transferred from there to the Royal Vic and seen immediately and kept there for a week, as I was also very low in hemoglobins, and they cannot believe I was still alive. But I felt great. From there, I met Dr. Buganin, my oncologist, who I also owe my life to. His knowledge and dedication to his patients is priceless. I was started on pre-op on September 4th, along with treatments of iron and, of course, canceling my Italy vacation. I also had an intern during this time who I will never forget. Her name is Dr. Saldana. There was one day in particular, she wanted me to do a scan and had explained to me where to go and how to get there within the hospital. She must have seen my confused look, because she came to find me to make sure I was in the right room. It's moments like this that stand out to a patient during their journey. Wow, I thought, my doctor came to check up on me. In March of 2015, I had my right breast and lymph nodes removed by Dr. Midarisian at the Glen. I was one of the first operations being performed at this newly built hospital. I remember Dr. Buganim telling me, "I want you to have your operation at the new hospital, the Glen." I don't have enough words to explain how comfortable Dr. Midarisian made me feel that day, before and after my operation. I remember how he joked with me and said, "Don't worry, I will leave you some cleavage so you can wear those fancy tops." Then in November, I started my radiation treatment at the Cedar. That went very well. I did my treatments and then waited 2 years for my reconstruction. Between 2016 and 2021, the fight against cancer continues. I'm given tamoxifen, then letrozole, and other medications. I go to my monthly visits with Dr. Buganim, along with blood tests. Sadly, in May 2017, it took me a while to find a doctor that was positive enough to perform, happily, my reconstruction surgery, as they all said my breast skin was too thin due to radiation. Understandably, they all confirmed that the fat I had on my inner thighs and stomach was not enough for reconstruction. Even if I eagerly told them I could gain weight, no worries. So I finally had my reconstruction done at the SHRM. I found a surgeon that was willing to try. She took the time to explain to me my situation regarding the reconstruction, pros and cons, and that she was going to do her best. She then looked up at me with a smile and said, "Hopefully you won't have to stuff your bras with Kleenex anymore." To which I replied, "Yes, please." In 2022, I was diagnosed with bone cancer, as they had seen a mass on my pelvic. So I had to have a full hysterectomy at the Glen. My recovery was fast, as the next day I was baking a cake for my nephew's engagement party, and then off to the party a couple days later. In 2023, my bloods weren't looking good again, so I started a new treatment every 3 weeks called In Her Too. In July, it was at the private clinic in TMR, and then I was transferred in February of 2024. Till this day, I am receiving In Her Too. As a matter of fact, I was there today. 2025. In January of this year, I needed radiation, so I met Dr. Scamini for a consultation. I can't say enough about the entire experience. She took the time, explained everything to me. Her knowledge of the field and the way she explained it was so interesting that I didn't want her to stop. Thank you, Dr. Scamini, for being so caring. You would ask me, what advice would you give newly diagnosed cancer patients? This is what I would say. Cancer is a tough journey, and the road ahead may not always be easy, but everyone has something inside of them that can help them stand tall and strong through it all. You need to find it and hold on to it. To me, these are the 5 ingredients that have helped me stay strong during these past 11 years, and hopefully it'll help others. My first is my second home, this hospital. 2, husband, kids, and family. 3, the hardest one to deal with, accepting yourself and all your changes. 4, the easiest, positivity. 5, going on with life. I'm here to stay. The hospital. This to me is such an important ingredient regarding the fight against cancer, alongside family and friends. You need to surround yourself with a caring group of people you trust and are comfortable with within your hospital. This is my group. Dr. Buganim, he's an incredible doctor, knowledgeable, smart, caring. The list can go on forever. I'm sure all of you know him here would agree. He's always one step ahead of my questions and shows me such compassion, which is incredibly important for all patients. And then when it comes to accessibility, it's remarkable. Send him an email. Then you think that he hasn't answered because it's 5 o'clock. No worries, he'll answer in the middle of the night. Go to sleep. I'm so glad he's my doctor since the beginning. Nurse Anne. Nurse Anne is on the clinic side. She's truly the best. She's always so caring and helpful, not just to me, but I see to every patient. No matter how busy she is, she will take the time She always greets me with a smile and helps me coordinate my last-minute tests I need. If necessary, she even walks me to that department. Medical imaging. Poly and medical imaging. Though not part of our cancer center, she's a numerous support to me. When I need help scheduling my numerous scans, she always takes the time in her very busy schedule to accommodate me right away or call me back to make it work. Dr. Midarisian, another great doctor. He was very supportive and can sense my stress of the day of my first surgery. He reassured me with jokes, which till this day makes me smile. I really appreciate the way he handled it and cared about my body, what it would look like afterwards, which is so important. And Dr. Skamimi, another incredible doctor. She went over and above what I was expecting, spending over an hour with me to make sure that I understood everything and answered all her questions. She also followed up numerous times, and we're only February. The next, yes, cancer has a direct impact on family, like we talked about today here. What hurts me the most and worries me more on a daily basis is how it hurts and affects my husband, kids, family, and friends, and that I have no control over it. My only wish is to give them strength and courage in dealing with this journey, which was no fault of theirs. I'm grateful every day to have such a great support from my entire family and friends, which are too many to mention, but I would like to mention a few. Especially my loving husband, who has been there for me every step of the way, with his truckloads full of love and patience for me, if you all know me, and hard work, because now he's the only breadwinner of the family. My daughter's support knowledge of the medical system and terms that I didn't even know existed, considering I'm a person who never took Tylenol. My sister-in-law, Nancy, who moved in with us during all my chemo treatments, radiation, and all my surgeries. The much appreciated weekly meals that were always delivered with love by Christina and Danny, errands accomplished by Louise and Dolores, and lifts to chemo treatments with Marlene. Excuse me. And most importantly, the love and support I received by my little daughter, Priscilla, then only 13 years old and having to try to understand what is happening to her mom and family. These are some examples how cancer does not just affect me, but affects my entire family. Physical challenges. The first was in the beginning. The physical challenges were hard for me, as I was a person that did everything on her own. Worked 7 days a week, was a wife, a mom, ran a business, but now I was extremely tired and felt helpless. I remember just wanting to sleep all day, and everywhere I went, I could not stay awake. The second, losing my hair. This was shocking to me. I ran for a wig right away. But a week later, I realized that I needed to accept myself the way I was. So I said no to the wig and yes to embracing myself as I am. I told myself cancer has chosen me and is part of my life now. I'm not afraid, I'm not scared, and not at all embarrassed. I was standing strong, showing up as me. The third was removing my right breast. Wow, that was hard to deal with. And then my hysterectomy, but I knew it had to be done. I went home with missing body parts, bandages, tubes, drains, to a loving and supportive family. Emotional and mental. Besides of all the emotional and mental stress that this cancer has caused me, including all my surgeries, chemo, radiation, etc., The thing that still lingers at least once a month is waking up the morning of my blood test, like this morning, and wondering what the blood test would show today. The constant worry, like we talked about tonight, because it seems to be that I'm on a never-ending journey. Another thing we talked about today, positivity. I was not going to feel sorry for myself. It's easy to give up and stay in bed, but that would not change the outcome. I really don't want my family and friends to see me that way. And honestly, for those who know me, that is totally not me. Instead, I decided to do two things. One was keep busy by offering my family and friends, how can I help? Whenever they're planning an event, a party, a DIY project, I gladly put my 2 cents in worth of suggestions and offer to help. Second most important thing is keeping very close ties with family and friends. I cherish my weekly dinners, which to me are priceless and worth the work. Helping others and sharing dinners with family and friends has helped me tremendously in staying positive throughout this journey. And finally, when I finally accepted that this journey was my reality, I made a decision. I was going to fight and I was going to win. I told myself, I'm here to stay. So I carried on with my life, baking wedding cakes, birthday party cakes, yearly Tuscan tours, helping my husband in the moving business and on the trucks, traveling, helping my friends in Tuscany with their olive harvest, etc., etc.
Oh, wow. Okay, ready? One.
I want to sincerely thank all the doctors, nurses, and technicians, volunteers, and staff at the Cedars Cancer Center. Your unwavering dedication, teamwork, and hard work makes this hospital my second home. And without you, it wouldn't be the lifetime it is for us during such a challenging time. Thank you. Sorry for the time.
Thank you, Teresa, for that extremely inspiring story about you, your family, and what you've gone through. Ladies and gentlemen, this brings us to the formal part of the lecture to a close. Je veux remercier tous nos conférenciers. Your presentations, ladies and gentlemen, were very thought-provoking and helpful. I'd like to now open the floor to questions. On peut prendre des questions. We'll take questions from the floor. And Rola, you'll help me. We have some questions online. Let's start from the floor. If you just want to raise your hand, if somebody wishes to ask Teresa, Dr. Hamel, Dr. Lee a question, they would love to entertain an answer. Anything from the floor? Yes, ma'am. So I'll repeat your question so they can hear it on Hollywood Squares. Do we have a cyber knife here and a nano? Yes, so I know here at the Cedars Cancer Center, because our foundation was involved, we do have the cyber knife. It is in one of the 8 bunkers in radiotherapy and radiation oncology, and it's used in breast and brain in specialized tumors for precision. So we do have that one. Maybe any other doctors would know, but that I do know.
So recommended, where they usually recommend surgery, sometimes super strong. And they may have remove other parts or touch other parts and damage other parts of the body. So why would they?
It's the multidisciplinary team, again, the surgeon, the medical oncologist, the radiation oncologist, the psychosocial care. So it's all together that they bring the treatment plan for each particular patient. So that would have to be taken up with your practitioners. Yep.
First of all, we've lost our hope. We don't have to be very, very big. Will there be anything left?
Sure, I have an answer for you. So Opal was a fantastic app that Cedars, our foundation, and the other hospital foundations gave seed money. We've been funding it for 9 years. We piloted it here at the Cedars Cancer Center with our cancer patients. So I met with Dr. Tara Kajal, who's head of radiation oncology, the chief of the division. And in the next 8 weeks, they'll be introducing a transition program for all our cancer patients here at the Cedars. So yes, they will find a transition program app that will bring us. The government of Quebec has announced EPIC. EPIC is the new electronic health record, but it won't be ready to be delivered in the province for probably 3 years. So we have to help the patients get this, as I say in good English, le pont, the bridge. So they will find, the clinicians will find a way, and in philanthropy, we'll be there to support. But you have a very good question. So yes.
In terms of a nutritionist. Now, I've spoken to girls outside and it seems that the colorectal cancer society is already putting something in place. What you didn't hear, because I remember I was here last year when we had the conference for blood cancer. Somebody asked the question and they said, yes, we do have someone. Now, what we do have and what I do remember in terms of what I received is someone who usually helps with what to eat or not eat during therapy, because it may affect radiation, or it may affect the other persons during radiation. What I believe we would need someone who's a specialist in specializing in cancer, where they can give information to patients post-surgery, during treatment, post-treatment. What is the right, or what is the right?
So I'll repeat your question for Hollywood Squares. You're asking about a nutritionist and where the nutritionist fits in the delivery of care. Perhaps, it's a very good question. Perhaps Virginia or Mark.
Well, if you have
Mark, maybe come up so they can.
yeah. So it's a very good question. If you have a pivot nurse, you can always address that request or him or her. If not, there's your treating team. So you can ask your physician to refer you to a nutritionist, but it is available here. Cora, you want to add something?
You want to come up and? Cora, thank you. One of our incredible healthcare practitioners. We're a big tent, big family.
So my name is Cora. I'm the IPO for melanoma. With your questions, we have a dedicated nutritionist dietitian that is assigned in the radiotherapy department. And for the ODC or the ambulatory care, we have 2. So we have Olga and I missed the other name, but Olga is more permanent. And the other one, sometimes it's temporary because of the short staffing among the nutritionists, but guaranteed we have dedicated nutritionist or dietitian to all our cancer patients. They may come and see you in person during your treatment, and most of the time they do teleconsultations. But then the teaching is more oriented during your treatment, and then after treatment, probably less, because then of the volume of the patients that are on treatment. But nevertheless, they will give you the information that you need.
Thank you, Cora.
Yeah.
Thank you, Cora.
Well,
Just to add also, we also have a cancer nutrition rehab program that has a dedicated nutritionist who works 2 days a week.
Thank you, Virginia, and we'll, at the end, please come up and give Virginia your coordinates and we'll get you the information. Diana from the house.
To what Cora just said, I requested the help of a nutritionist. It was not easy to figure out how or what and why. And I worked with Olga, and she is extraordinary. I have never met a nutritionist like Olga in my life, and I've seen about 10 or 20 of them, and she is a pearl.
So Diana from the house is asking, commenting on the nutritionist in the multidisciplinary team that Cora was mentioning. Her name is Olga. So anyone who needs information, come up and leave us your coordinates after and we'll get you some more information. Any other questions in the house before we go online? Any comments? Senator, do you want to come up and so they can hear you in faraway land?
Well, thank you, Jeff. And first of all, we're very proud of Terry. So it's an emotional story, and I'm emotional myself just to have heard it. So we're very proud of you. We love you and keep up the good work. We all need models, and I think, and Terry said it well, we need hope. And I can tell you, having been, we're family. My wife is her cousin. And being close to Terry, we've seen what she's gone through. And I can tell you one thing, she's never lost hope. She's always fought the good fight, and we're very proud of her. And thank you for sharing your story. I mean, it takes courage to fight cancer. I think we all need a model, and I think she's a model for many to follow. She's fighting cancer. Like she said, she's there to stay, and it's very important. And we often, today, we hear so many things. But what we miss most often is gratitude. We must take the time to say thank you. Thank you to family that supported her. Thank you to all the great doctors. And I also see Anthony, who's a survivor here. And thank you, Anthony, for being here. Thank you, all of you, for being here. And thank you to people like Jeff that keep getting involved, keep contributing, and never asking for anything in return. So I see you that you're very involved, you're there. And to our nurses too, our nurses, our doctors that do so much work. I speak to so many medical professionals across the country. And the volume is just tremendous today. The volume with what they deal with. And when we do hear a story like Terry's, where the doctors, and I can tell you the doctors return to calls very quickly, return to emails very quickly. And we must say thank you, because if the system does work and still keeps working, and when it needs improvement, but if it still keeps working, it's because of our patients that have the courage and the patience and the hope. It's because of our doctors, because of our nurses, and because of our volunteers. And we never say thank you to our volunteers like Jeff that make it happen. Alors merci à ceux qui contribuent autant dans notre système de santé, nos médecins, nos infirmières, nos volontaires comme Jeff, et bravo à tous. And Terry, keep fighting. We love you and keep fighting, and hope never dies. So hope is important for all of us. And thank you.
Thank you, Senator Lafreda. Ladies and gentlemen, we have a couple of comments online, and I'll repeat them, Rola.
So you are an inspiration, Teresa. We love you. We're proud of you. Breast cancer journey for me as well is from, I understand you keep strong. Another comment was, my first treatment, the nurse asked me who your doctor is. When I answered Dr. Boganev, they all said, oh, an angel. You know he's a great one. When the nurses say he's number one. What else? Well done. And thank you, Teresa, for sharing your inspiring story of hope and strength. So we're going to go for the questions. There's 2 questions online. Does the Sears Center have a support group for individuals who have a rare type of cancer?
So people can see it online, but to repeat it, does the Cedars have support groups for rare cancers? You want to do it? Maybe Virginia?
So at the moment, we do not have an individual support group that's dedicated to rare cancers. We have one peer support group.
To have one art therapy support group,
We have an art therapy support group.
and then we have the cancers.
That's right. We have two. So no. So there are two, and at the same time, we work in conjunction with the distress screening nurse program manager, and we're looking at developing more programs and more support groups for other types of cancers.
Thank you. Thank you, Virginia. And the last question?
Last question, and we cover the subject on breast density and breast cancer for the next presentation.
So that's a very good question. Will we look at breast density? So we can say that we will have a public lecture on breast cancer. So the Cedars Can Support Public Lecture Series, we always begin the year on February 4th with World Cancer Day, this incredible day of advocacy and information. And then throughout the year, we have breast cancer public lecture, probably kidney, bladder, prostate cancer lecture. We've had melanoma, skin cancer lecture in the past. We've had colorectal. We're looking to lung, and we're looking to probably ovarian and women's cancers. So these are public lectures that will be coming. Again, stay in touch with Cedars Can Support. If I can do a shout out, we do have our founder in the house, Gwen Nakos, who when I did mention you hadn't arrived, you were parking. So Gwen founded this organization 35 years ago. Do you want to say anything on that? And Gwen's story is very moving as well. After battling two times, and she's been an incredible volunteer, as Tony has mentioned. Our Cedars Can Support are led by volunteers who day in, day out help our cancer patients and their families as they navigate their treatment plans. So Gwen, thank you for being here. But ladies and gentlemen, and to those watching, please stay in touch with Cedars Can Support. I want to say thank you to our Cedars Can Support professionals and to our volunteers. So to Virginia and Anna, the co-directors of Cedars Can Support, to Rola and to Malcolm and to Lauren, day in, day out, who are working with our volunteers, working with our support groups, working with our complementary therapists, as Virginia mentioned, as Rola mentioned, support groups, music therapy, art therapy, meditation, exercise, look good, feel better, massage therapy, pet therapy. These are all programs and services that are delivered for our patients. To the Cedars Cancer Foundation team, and I see a few folks here. Ariel was here, Shoshana, Michelle Laforêt, who does our communications, Angus back in our office. For our small team, we're here to support you, Anthony, and our many board members, volunteers, as Senator Lafreda said. Volunteers are everything. Volunteers are helping, assisting, being a listening ear for the patient, helping us raise money. Sometimes they see Jeff Shammy and they cross the street if I'm coming to ask for money. But money, any donation helps, and it's important. If you have the means, God bless, we're grateful. And I think what Senator Lafreda said at the end, and Terry, you said it so well, gratitude. We must say un grand merci. We must say thank you. And on that note, I just want to end. We do have a questionnaire, and if I'd like Malcolm to come up, there is a little questionnaire that we'd love to hear you answer some questions. It would take a moment. You can scan it on your iPhone and answer it later. There are 5 questions, and there's some outside. Your feedback for us will make us do a better job next time. How did you hear about us? It was in the Suburban. It was on the radio. It was in social media. It was in the Westmount Independent. It was on posters throughout the hospital. Your doctors and nurses gave you the poster. Tell us how you heard about it, how we can tell more people about it, because it's all about spreading the information, spreading the word. Again, to all the allied health practitioners, to the doctors, the nurses, the technicians, the medical staff, the volunteers, the Cedars Cancer Board volunteers. I see Ness, I see many in the house that help us. Thank you. We're very grateful. Bonne soirée.